This video has been provided by the Home Infusion CLABSI Prevention Collaborative. Thank you in advance for watching this video. This video shows a patient and a caregiver, such as a family member, friend, or neighbor, working together. This video will be presented in 10 sections. Section 1, Introduction. Section 2, How to get started. Section 3, Hand hygiene. Section 4, Prepare a clean workspace. Section 5, Gather supplies. Section 6, Prepare supplies. Section 7, Scrub the hub. Section 8, Pulse flush. Section 9, Ready to connect. Section 10, Disconnect and flush. Section 1, Introduction. This video is designed to be a guide for those who are taking medications that come to them in an elastomeric device, a ball that slowly infuses the medication into your IV line. This may also be called a medication ball, or by a common brand name, Eclipse ball. Please ask your home health nurse, infusion pharmacist, or doctor for specific instructions, as some of these steps may or may not apply to you. Please watch this video as many times as you need. If you have a caregiver or family member assisting you, please have them watch this as well. Section 2, How to get started. Now let's get started. Your nurse will go over your provider's orders for your medication ball. The first thing to think through is the timing of the infusion. You will need to take the medication out of the refrigerator in advance. Your home health nurse will tell you how far in advance you should take the medication out. This will allow the medication to return to room temperature. If you forget to remove the ball prior to starting, it will not cause you any harm, but you may feel chilled during the infusion and it will take longer. Do not attempt to warm up the ball. Now, let's talk about the most important step, hand hygiene. Practice good hand washing. Washing your hands helps reduce your chance of infection. Use soap and water at first. Make it a habit to wet your hands. Apply soap until lathered, and then scrub your hands for at least 20 seconds. To make sure you are taking 20 seconds, sing the happy birthday song twice. Then dry with a clean paper towel. You can use hand sanitizer after you've already washed your hands with soap and water. If you use hand sanitizer provided by your healthcare team, rub a nickel-sized amount between all parts of your hands using friction for at least 20 seconds until they are dry. Never wave or blow on your hands to speed up drying. Even if you are using gloves, you must still wash your hands. If your nurse tells you to use gloves, put your gloves on after washing your hands. Section 4, Prepare a clean workspace. Now it's time to prepare a clean workspace. Before each infusion, find a clean, dry, hard work surface to set up your medication and supplies. If your nurse gave you a SAS or SASH placemat, put this mat on top of the work surface. Clean the workspace, including the SAS or SASH mat, with a gentle cleaning solution, such as a disinfectant spray, or with alcohol pads. Wash your hands like you did before. Section 5, Gather supplies. Your home infusion agency will provide you with these supplies. If you are missing any supplies, contact your home infusion agency. You will need 2 saline syringes, 1 heparin syringe if prescribed. Most will not need heparin. 1 medication ball, 5 to 10 alcohol pads to clean your supplies and hub or IV line tip, 1 trash bag, such as a small grocery bag, 1 sharps container. You've already removed your medication from the refrigerator in advance of the infusion. Double check your medication. Compare the information on the bag to your orders and make sure it is the same. Does the medication have your name and date of birth? Is the medication name correct? Is the medication amount correct? Is the medication expired? If any of this information is wrong or the medication is expired, stop. Do not start the infusion. Call your home infusion pharmacist immediately. Section 6, Prepare supplies. Wash your hands as you did before. Now prepare your supplies. First, place the alcohol pads on the SAS or SASH mat. Unwrap the saline syringes and place them on the first and second S of the SAS or SASH mat. If your provider has ordered heparin, unwrap the heparin syringe and place it on the H. If your medication ball is in a plastic bag, remove it from the plastic bag. Place the unwrapped medication ball above the A of your mat. Locate the tubing and remove it from the wrapping. Remove the white tape and the blue clip from the tubing. Move the clear plastic wrapping to the side. Place the trash bag close by and the sharps container within your reach. Wash your hands as you did before. Section 7. Scrub the hub. You are now ready to prepare the syringe and scrub the hub. First, pick up the saline syringe from the first S on the SAS or SASH mat. You will need to get rid of the air bubbles in the syringe. Loosen the cap of the syringe, but do not take it off of the syringe. Hold the syringe with the end up and plunger at the bottom. Pull back on the syringe plunger slightly to break the seal on the syringe. You will be able to see the tiny air bubble in the syringe. Slowly push the plunger up to let that tiny air bubble out without pushing off the cap. If the cap falls off, you will have to start again. Tighten the cap back on the syringe. Once the air is removed, you are ready to flush the IV line with saline. With an alcohol wipe, scrub the end cap of your IV line, or the hub, for at least 15 seconds using friction. Be sure to get on all sides as well as the top. This is scrubbing the hub. Do not let the end cap touch anything, and do not touch it. If you do, you will have to scrub the hub again. Discard the alcohol pad. Section 8. Pulse flush. Now you will pulse flush the end of your IV with saline. Remove the cap from the saline syringe. Attach the saline syringe to the center of the hub and push and turn clockwise until attached. Be sure to unclamp any clamps on your IV line. Now push 1 to 2 milliliters of fluid at a time using the push-pause or pulse flush method until the saline syringe is empty. Remove the syringe. If it is difficult to flush, make sure that the clamps are unclamped and try again. If you are still having trouble, contact your infusion provider. Section 9. Ready to connect. Now you are at the A or administer. You are ready to connect. With an alcohol wipe, scrub the end cap of your IV line or the hub for at least 15 seconds as you did before. Remove the protective cover or cap from the tubing of the medication ball. Scrub the end of the medication ball tubing. Do not let this tip touch anywhere. Now connect the tip of the medication ball to the IV line's end cap using a push and twist motion like turning the key in the ignition. Now sit back and relax. The medication will infuse for a varying amount of time, depending on the prescribed time and how warm it is. Your nurse or pharmacist will tell you about how long the infusion should take. When it is time to finish, look carefully at the medication ball. You will know when it is done when there are no bulges in the inner column. Disconnect only when there are no bulges in the inner column. Section 10. Disconnect and flush. You are now done with the infusion. Now you need to disconnect and flush. First, wash your hands like you did before. Now, close the clamp on the medication ball. Twist off the medication ball tubing from the end cap. Wash your hands as you did before. Pick up the saline syringe from the second S on the SAS or SASH mat. You will need to get rid of the air bubbles in the syringe. Loosen the cap of the syringe, but do not take it off of the syringe. Hold the syringe with the end up and the plunger at the bottom. Pull back on the syringe plunger slightly to break the seal on the syringe. You will be able to see the tiny air bubble in the syringe. Slowly push the plunger up to let the tiny air bubble out without pushing off the cap. Tighten the cap back on the syringe. Once the air is removed, you are ready to flush the IV line with saline. Keep holding on to the syringe. Now scrub the hub with an alcohol wipe like you did before. Discard the alcohol pad. It is now time to pulse flush. Remove the cap from the syringe. Attach the saline syringe to the center of the hub and push and turn clockwise until attached. Now, use the push-pause or pulse flush method. Push 1 milliliter of fluid, pause, push another milliliter of fluid, pause, and keep going until the syringe is empty. Remove the syringe. If your provider has ordered that you also flush with heparin, pick up your heparin syringe. Loosen the cap of the syringe, but do not take it off of the syringe. Hold the syringe with the end up and the plunger at the bottom. Pull back on the plunger slightly to break the seal. You will be able to see an air bubble in the syringe. Slowly push the plunger up to get the air bubble out without pushing off the cap. Tighten the cap back on the syringe. With an alcohol wipe, scrub the hub like you did before. Remove the cap from the syringe. Attach the syringe to the center of the hub and push and turn clockwise until attached. Now, push 1 to 2 milliliters of fluid at a time using the push pause or pulse flush method until the heparin syringe is empty. Remove the syringe. Wash your hands one final time as you did before. You have now infused your medication ball. If you have any problems with your infusion, call your home infusion provider.